obviously before they send me home, they said, I think you should have this remote monitoring system put in. And at that time, because we live about 3 and a bit maybe hours from Calgary, and so they said we just put this little. They had the defibrillator put in, and then they just gave me this little box, and which is like just looks like this. So yeah, so it's pretty handy. It just sits by my bed at night. And I've used it probably 3 or 4 times now over the last time. It just, if I have a bad rhythm, or if then I just take this little thing and I just put it right there, and I call the number, and they get real live information. And so like I like it because it's like it's a comfort level for me, right? So they can tell me like if it's ever gone out of rhythm in the last few months, if it's beating too fast or too slow, or any abnormalities.
We put in cardiac devices for patients who have disturbances in the electrical rhythms of the heart. Sometimes people's hearts can go too slow, and sometimes people's hearts can go too fast, and that can be life-threatening. Okay, so for patients whose hearts are going too slow, we'll often put in a pacemaker. Okay, and a pacemaker helps to keep the heart rate at least a basic rate, which is typically about 60 beats per minute. And it helps to correct that electrical disturbance and keep their heart from going too slow. Okay. For patients who have heart disease and their heart may have a tendency to go very fast into a life-threatening arrhythmia, those patients would tend to possibly get an implanted defibrillator. And the defibrillator will be able to pick up when the patient's heart goes into a bad, dangerous, life-threatening arrhythmia. And the device will pick that up, and it can deliver a shock if it needs to help convert that rhythm back to a normal rhythm, okay, and potentially save that patient's life. The third type of device, like I said, that we put in would be a loop recorder. The loop recorder is where we have symptoms, but we don't really have any evidence as to what's going on. And the loop recorder would actually just sit there and monitor the patient's heart 24/7 and report back to us if there's any electrical disturbances that are picked up. And then we can decide if they actually need an implanted pacemaker, or maybe they need an implanted defibrillator. So those are the basic types of devices that we deal with.
This is the remote monitor that we provide to patients. They can send remote transmission. And so as you can see, it's pretty simple, just like basically with a reader and a little base and a little circle button in the middle. So pretty much what they need to do is just to press that little circle button. You can see pictures showing up, pretty much telling you how you kind of do the transmission. And then you just lift the reader off, and then they will tell you you're going to locate your defibrillator or pacemaker, and then you're going to put it right on top of that. And you can see, and then we'll start downloading information, and you can see the picture on the reader too. So you can see the status. Usually the downloading information takes less than 5 minutes. Once that finishes, we'll tell you to put the little reader back to the base. And then after that, everything is automatic. Information will be sent to the server, and then one of our nurse clinicians will receive the information from the website that we go to, and then we can review all the information and transmission with the patient.
The Perform Team is an idea that was crafted by Dr. Exner and myself. Our thinking was basically to look at the whole journey of these patients, because my heart just breaks when I see these patients being very challenged, and also for the care providers trying to make ends meet because of the too many duplications, unnecessary duplications that should not be there. So when the clinical network started getting application, we submitted our whole thought to look at not only remote monitoring, but the whole patient journey of these patients. And I tell you what my vision is. Our vision is there should be an equal and timely access for these patients, regardless of where they live.
I feel supported, and I feel that it's gone beyond just, you've had the procedure and then you're cut adrift until 6 months from now where you show up in the clinic. I know that if I have some funny symptom, I can always call and say, gee, should I send you guys a transmission for this? And they'll always say, yes, you should. I think I did that once when I was very nervous early on and it came back just fine. But we had another time where we interrogated and I found out I had atrial fib for 12 hours. So that made me kind of think, oh, okay, I've just got to pay attention to these symptoms because it could be something that I should just not ignore. So from my experience, adding the remote monitoring has given me a little bit extra sense of security. I just know that if there's any issue, they will be alerted and I will get a call from them automatically. That just gives me one other little piece of security.
Maureen had alluded to, I think, something very important to realize about remote monitoring. It's not just about convenience for patients. It's also about patient safety. And she really struck on an important note with that, because basically across the board with the various vendors, if there's a problem with the system, or if a patient receives a shock from their defibrillator, for example, we're automatically notified of that. Okay, so there is, if you had a fracture or something in a lead wire, things like that, then we're automatically notified about those happenings. So those are really important that we address those. Without remote monitoring, you would never know until something maybe catastrophic happened to the patient. With remote monitoring, we're notified right away.
So I think one of the reasons that this program has been so successful and well accepted is this is really a great example of patient-centered care. We often talk about patient-centered care, yet we typically just give it lip service. This is truly patient-centered care. So patients can receive care in their home, in their local community. They can do it on their time, on their schedule. They're not tied up for a day traveling back and forth to see us in clinic. They're not tied up with their family member having to drive long distances. And we can actually provide care in their homes at a time that's convenient to them. So patients love it, their families love it. For our clinic, it makes our clinic far more efficient, and it's really given us a great opportunity to show how well this works in the current pandemic we're in right now.
They have that technology, right, where it's quick, it's accurate, it's dependable, and it gives me the confidence to think, I can live out here. Because how many people are out in rural Alberta, whether it's in the north or like I'm out on the east side of Alberta, and they something bad happens to them and they're like, I think I better move closer to a hospital because you know what, I'm not going to get the care. Like I hear that every day, right? I'm not going to get the care I need, right?
If we're talking about the patient experience, I think an individual's perception of their illness or their injury and how the healthcare team treats them. Nurses are taught to look at not only the patient's physical health, but also their psychological, their emotional, their social, and their spiritual health. So each of those areas of need has to be met in order for the patient experience to be a positive one. So when you can meet all of those needs and provide a really positive experience and you get that feedback, it feels pretty good.
So unfortunately, we had a relatively short period of time to put the project together at the start. But once we did, we started to engage patients. I mean, patients have always been part of our process. That's always been part of our approach to care. We care what our patients think. We change what we do based on our patients' feedback. And patients and patient representatives have been part of this program from the outset. So whenever we look at how can we make something better, we simply ask our patients.
Right? We're not going to be able to deliver the specialists to every hospital. But by using technology like this, like, video visits, the remote visits that have really blossomed, I'd say, during the COVID pandemic, what we're able to do is not deliver the specialists into the rural communities, but we can deliver some of the specialist care into the rural communities. So it's not everything, but to the extent that we can do that, I think the benefits accrue to the citizens of Alberta, to our patients. The advantage of some of this remote technology is we really can deliver care more broadly in the patient's home, 10 hours away from where we are, almost like if they were down the street.